If you have ever had this feeling, then you will need a filling. A cracked tooth. No, I wouldn't advise you fix a cracked tooth yourself or at home. If you have a cracked tooth, maybe due to a fall, I would suggest you visit your dentist. Depending on the nature of the crack, we dentists could restore your tooth using the material, or we could give you a full crown to restore the tooth back to its original shape and form. So yes, if you have a cracked tooth, it's better to visit your dentist rather than doing it at home. It's not normal for your gums to bleed when you brush. If your gums bleed when you brush, it could be one of two reasons. The first could be related to your brushing. It's either you're using a hard brush or you're brushing too vigorously. If you use a hard brush, it's better to switch to a moderate textured toothbrush. And if you brush too vigorously, you have to reduce the pressure or the force you apply while brushing. If it's not any of these, then it's most likely you have an inflammation of the gum, which makes the gum swollen and more prone to trauma or to injury, causing them to bleed. If this is the case, I would suggest you visit your dentist for a consultation and an examination so you can find the problem and treat accordingly. You just had whitening done and you want to keep it white. Let me mention that when you have whitening done, it doesn't make your teeth white permanently. It just gives you the white shade for a couple of months before returning back to its original shade. Now, to keep your teeth white after whitening, or to prolong the whiteness after whitening, you have to pay attention to the food you eat. So, it's very important you abstain from colored food. For instance, chocolates, dark chocolates especially, you have to abstain from that. Also coffee and tea. Then other things like red wine, like ketchup, like red food basically, like Coke, Fanta, they stain your teeth and your teeth has a way of taking up these things. So to prolong the whiteness of your teeth after whitening, you should avoid this kind of food, this kind of colored food. You need a filling. That's a very important question. Let me paint this scenario. Have you ever had an experience where after eating, you have food particles stuck inside your teeth? I do not mean in between your teeth now, but inside of your teeth. And you have to use a toothpick or the sharp part of a dental floss stick to get the food particles out. If you have ever had this feeling, then you will need a filling. Sensitive to hot or cold. When you put your finger over fire or inside ice, it hurts you, right? You feel something. Exactly. Because your finger is alive and it has blood vessels and nerves. Similarly, your teeth is also alive and they contain blood vessels and nerves. So when you expose them to heat or cold, basically to extremes of temperature, the nerve fibers are excited and they react as pain. I hope you found this video helpful and educative. To get more of this, please like, comment, and click the subscribe button.